Pregnancy presents a very unique time in a woman's life because if her health is good during pregnancy, that improves pregnancy outcome for her, but also can improve outcome for her baby. So it is a nice time in life for women to think about their diet, exercise and their lifestyle in general. Now ideally women would look at this before they get pregnant so that when they get pregnant they're in the best health possible. So things to think about are diet quality, so what sort of foods are being eaten, looking about exercise and then of course the woman's weight. So for example, if women are overweight or obese, all of the risks of pregnancy are increased. There's increased miscarriage, increased difficulty getting pregnant, diabetes in pregnancy is increased, blood pressure is increased risk, and caesarean delivery and blood loss, all of these risks are increased. So obviously if a woman can achieve a normal weight prior to pregnancy, she's going to reduce all those risks. In terms of nutrition, we know that diets high in sugar, processed foods, cakes and biscuits, that causes elevation in mother's sugars and that can cause diabetes in pregnancy, but of course they can cross into the baby and perhaps cause the baby to grow more than they should and lead to a large baby at birth. So reducing sugar in the diet, sugary drinks for example, processed foods, and then choosing food that releases sugar slowly into the bloodstream. Examples of that would be brown bread instead of white bread, porridge instead of sugary cereals, and really looking at vegetables as well, which are a good option. Another part of the diet to look at is vitamin D. Now those of us in Ireland with very little sunshine suffer with low vitamin D levels because the skin produces vitamin D in response to the sunlight. So we need to get vitamin D from our diet. And the best sources are oily fish such as salmon. So during pregnancy, of course, the baby is growing, the baby's bones are growing, and the only source the baby has of vitamin D is the mother's diet. So women should look at eating at least 2 portions of salmon a week, look at eating meat and eggs to bring up their vitamin D. Exercise then is another area that's important. We did some very nice work here in National Maternity Hospital and UCD looking at mood in pregnancy. And we found that women who walked 30 minutes per day had better mood in pregnancy. So people can think about that in preparation for pregnancy, increasing their exercise. It will increase their mood, it'll improve their sugars, it'll lead to a more normal weight. We're certainly finding there's a lot of interest in lifestyle in pregnancy. So when women are pregnant, they're looking at their diet, they're looking at exercise, and they're looking for information. And when we run lifestyle education classes, women are very appreciative of them and are very willing actually to change their lifestyle. So pregnancy is one of those times in life where people are open to change. They understand that anything they do to make themselves more healthy is going to benefit them, not just for the pregnancy and for better delivery outcomes, but for their longer life, but also for their baby. They know that if they eat healthily, they exercise well, their baby will be a more normal size, and it puts their baby on a sort of a healthy track. So we do find pregnant women very open to advice, and I suppose it would be lovely if women prior to pregnancy were also considering that. Weight gain in pregnancy is important to consider as well, because if women put on too much weight in pregnancy and there is this sort of feeling of maybe eating for two, that can lead to increased pregnancy problems. So in fact the increased calorie requirement is only 300 calories per day, which is really like a small sandwich. And even women who are normal weight in early pregnancy, if they overshoot what's recommended, they're at increased risk themselves of being overweight after pregnancy, and we all know how difficult it is to lose the bit of weight after pregnancy, but it also in pregnancy increases the risk of diabetes, increases the risk of caesarean delivery. So in pregnancy women should keep an eye on their weight, and for normal size women we're looking at perhaps a 1.5 to 2 stone weight gain, but if women are overweight or obese, we would be looking at maybe half a stone weight gain or maybe a stone weight gain. So it is worth watching weight gain in pregnancy, keeping an eye on it and doing your very best not to exceed what we recommend. Pregnancy is a very, very exciting time, and planning a pregnancy is also a very exciting time. So I think in preparation for pregnancy, people can look at their diet and lifestyle. There's so many lovely foods out there. We've all sorts of fruit and veg now that we have access to that we didn't have previously. And I would encourage people to cook their own, prepare their own food so they know what has gone into it, they know the nutritional value, and of course they will enjoy the foods that they prepare. And pregnancy is a very nice time, it's an important time, and it's a great opportunity to have a good healthy lifestyle.